A 17-year-old man is brought to the physician by his mother because she is concerned he may have depression. He had broken up with his girlfriend about 6 months ago, and starting about 2 months ago, he started having progressive behavioral changes. His mother says he has missed school repeatedly, preferring instead to stay in his room and sleep most of the day, and as a result, his grades at school have dropped, and the school has expressed concerns about his attendance. He often forgets or refuses meals. He refuses to see his friends when they come by to check on him, and rarely participates in activities he used to enjoy. When the physician speaks with a patient, he denies feeling depressed or suicidal and says, "I still want to graduate school. I just feel too tired all the time." Which of the following is the most likely diagnosis? Choice A, adjustment disorder. Choice B, major depressive disorder. Choice C, narcolepsy. Choice D, oppositional defiant disorder. Or choice E, social anxiety disorder. I'll wait 5 seconds and answer the question. On step 1, typically I like to say that MDD questions tend to be pretty straightforward. They usually give you fairly obvious vignettes, and then all the wrong answers will be more obviously wrong. But especially when you get into step 2, they're going to start making you very specifically differentiate between adjustment disorder and MDD, and that can be very difficult. That's the point where you have to be very familiar with your SIGI caps and actually go through the question and ask yourself if he actually fits MDD for a lot of these harder questions. So if we go through the SIGI caps real quick, first, sleep, that's a positive here, right? He's been sleeping a lot. Interest is positive because he doesn't go out with his friends or do things he enjoys anymore. Guilt is a negative. It doesn't express anything about guilt in this question. Energy is positive. He straight up tells you that he's tired all the time. Concentration would be a positive. I mean, he can't really focus at school. He can't really get his tasks done. That counts as concentration. Appetite is a positive because it told you that he doesn't, he skips meals or he forgets them. Psychomotor is probably a negative in this situation, and suicidal ideation is negative. Regardless, you have 5 of the 9 criteria met in the SIGI caps, and this has occurred for a duration of longer than 2 weeks. So the correct answer choice here is B, major depressive disorder. So yes, these questions can be very difficult, and here the patient even claims to not feeling depressed. But on USMLE, and even in real life, it's not required for them to straight up say they're depressed. They might even deny feeling depressed. And regardless, this patient has anhedonia, right? So like I said, the big DDX here is with adjustment disorder, choice A. So choice A, adjustment disorder, this happens within 3 months of a stressor. So if you'll notice, he broke up with his girlfriend 6 months ago, and his symptoms didn't start until 2 months ago. So that's actually a bigger gap than 3 months. So technically, just from that also doesn't fit adjustment disorder. Although sometimes on USMLE, yeah, they can be a little bit fast and loose with the time frames at times. Another thing with adjustment disorder is that these symptoms do not last more than 6 months after the stressor. Here, I would say it's borderline. Obviously, his symptoms didn't start until after the stressor a fair amount of time, and if you're going to count from that, it hasn't been 6 months, so you can't say one way or the other here. But importantly, he has a disruption to his normal functioning, right? If a question tells you that a patient can't complete their tasks at work, or they can't go to school anymore, or they just can't function normally, that's way more suggestive of MDD than adjustment disorder a lot of time. So, like I said, adjustment disorder versus MDD, yes, it can be very difficult, and yes, you do have to sit down and actually know your SIGI caps. The easier questions will be pretty blatant on which one it is, but sometimes you just gotta sit down and actually go through and say like, oh yeah, this one's positive, this one's negative, and figure out if it counts as MDD or adjustment disorder based on that. So let's look at some of the other wrong answer choices here. Choice C, narcolepsy. This is uncontrollable sleep attacks and cataplexy, and sometimes they have hallucinations upon sleeping or waking. This is called hypnagogic and hypnopompic hallucinations. This patient doesn't have involuntary sleeping attacks, which is what narcolepsy is more like. This is more just hypersomnia, which is consistent with MDD. Choice D, oppositional defiant disorder. This patient isn't anything like that. I mean, yes, he doesn't go to school anymore, but oppositional defiant disorder is usually some kind of disruptive or irritable child who's just kind of defiant to his authority figures, as the name suggests. So usually it's like a disrupted kid during class. They show no respect to authority figures, your teacher in other words, and it'll last for more than 6 months. What they really like making you differentiate with is conduct disorder, which is a precursor, quote unquote, to antisocial personality disorder. Conduct disorder is basically antisocial personality disorder, except in minors. And the big difference with oppositional defiant is that conduct disorder will include often law-breaking behavior. So they'll be violent, they'll be stealing things, they'll do destruction of property, they'll lie, they'll do forgery. So they're out there breaking the law, is the simple way of putting it. Choice E, social anxiety disorder. I mean, yes, this patient isn't socializing with his friends anymore, but he has so many more other symptoms that are suggestive of MDD. And the stem of his behavior isn't like social anxiety disorder, where you are fearing social consequences or embarrassment. This patient has lack of interest or anhedonia and lack of energy, which is more consistent with the correct answer choice, major depressive disorder. So bringing it back, major depressive disorder, you just gotta remember your SIGI caps. S is for sleep, I is for interest, G is for guilt, E is for energy, C is for concentration, A is for appetite, P is for psychomotor disturbance, and S is for suicidal ideation. And on top of that, depression also counts as one of the 9 criteria, right? So you gotta sit down and put in the work for this sort of thing. I hope you found this video helpful. I'll see you in the next one.